Hello, everyone, and welcome to today's session. I want to thank you for being able to attend. My name is Javon Dominique Kafua, and I work here in the Office of Alumni Relations at Northeastern University on educational initiatives. I work to coordinate this month's course and the interactive session with my colleague, Molly Herman, and today's faculty expert, Neil Maniar. Neil is a professor of practice and the director of Master of Public Health and Urban Health at the Bevay College of Health Sciences at Northeastern. We appreciate you taking the time to join us today to cover the material from this month's course and interact with Neil. If you have any questions throughout today's session, please be sure to utilize the chat box that's located on the lower right-hand corner of your screen. We will answer the questions in the order they are received. I will now go ahead and hand this off over to Neil.
Great, thank you for that introduction and welcome everyone. I hope you can all hear me okay. What I'd like to do this afternoon is spend a little bit of time and just give an overview of some of the material that's been covered. We're going to start with a broad perspective on public health and then talk about some of the core themes and frameworks and constructs that we often encounter in our public health work and those themes that really shape much of the public health work that's taking place today. And then I'd like to talk a little bit about some of the practical applications within the field of public health, and we're going to focus on two areas. So one is community health assessment, and then the other area is planning health education and health promotion programs. I'd like this to be a truly interactive session, so feel free to ask questions along the way. You can either chime in or you can put a question in the text box. I'm also going to be throwing some questions your way as I go through some of these slides. So for those responses, it'd be great if you could just write responses in the chat box. So. And then I'm also going to be leaving some time at the end of the session so that you can ask additional questions if you have any. So let's start with just broadly, what is public health? And when we think about public health, there are lots of different things that come to mind because the field itself it's really broad. And that's one of the wonderful things about the field of public health is that it captures so many different facets of health. It involves so many different areas of activity, and it really enables individuals to not only follow their passion and apply their expertise, but you can work on a number of different areas simultaneously. So public health involves surveillance for different disease outcomes, infectious disease outcomes, surveillance for risk and protective factors involved with different health outcomes. It involves data analysis. It involves examining disease outbreaks, whether they are infectious disease outbreaks or if we see clusters of diseases in certain areas. Oftentimes, if we start to see an increase of cases of certain types of cancer in a certain area, we will start to examine what's going on and see if we can trace some of the factors that are involved with that elevation of incidence of those types of cancers. Public health also involves disease prevention, and this is across the entire spectrum of prevention. So it involves everything from increasing screening and access to prevention measures to addressing some of those root causes of health that could help prevent disease later in life. An important area of public health is the whole area of communication. So how do we communicate public health messages? How do we bridge some of the gaps that we face in terms of health literacy, in terms of health communication? How do we make sure that all sectors of the population have equal access to information and that the information is presented in a way that's really accessible for individuals? Sometimes in public health, we get really mired in the jargon of public health language. And what's really important is taking what we find through research and other areas and being able to translate that in a way that the community can really understand and apply that information. Public health, of course, also involves research, risk assessment, and health promotion. So developing public health promotion messages, trying to prevent, really using health promotion as an important vehicle for prevention and wellness. So one of the first questions I'd like to throw out at you is, when you think of public health, when you hear the term public health, what comes to mind for you? Are there other areas that are not included on this list that you see falling within that umbrella of public health? So feel free to just type your answers in the chat box. So as we think about public health today, there are a number of key themes that really drive our work in the field of public health. This is by no means an exhaustive list of the themes in public health. There are many, but what I wanted to do is just highlight 3 overlapping themes that really drive a lot of the work that we're doing to improve population health, and importantly, improve the health of individuals and families and communities in urban environments. So some of these themes include social determinants of health, which we're going to talk about in much more detail, social justice, and health equity. So these themes are all related to help us answer those questions around, why do we see such significant disparities when it comes to not just health outcomes, but economic outcomes and environmental outcomes? What is the role of social justice in improving the health of communities? What is the role of social justice when we talk about not just empowering communities, but really addressing important issues that have an impact on the health of society at large? So these are just some of the themes. Here's my second question to all of you. What are some of the themes that you see as driving public health today? I see access to healthcare. That's a really important one, both as an important area of public health and as a key theme for public health. One of the things that we see these days, especially with all the debate around healthcare legislation, is the Affordable Care Act played a big role in making sure that individuals in all segments of our society have access to the healthcare that they need. And as public health professionals, it's really critical that we do everything we can to not just maintain that access to healthcare, but to improve it for individuals who face barriers when accessing healthcare. So when we talk about health, health is something that we can define in many different ways. One of the first things that we often think about when we think about health is physical and mental health, because that's the type of health, the definition of health that we are most familiar with, that we tend to focus on the most within clinical settings. But when we think about health, when we define health in the context of public health, it's important to take a broader definition to health. So it's not just physical health and mental health, it's emotional health, it's environmental health, economic health, intellectual health. So all of these different areas of health that come together and that really influence one another. When we think about environmental health, it's certainly issues of environmental justice come into play here. Same with economic health. So the economic health of a neighborhood can have a significant impact on the physical and mental well-being of the individuals who live in that neighborhood. So as we think about some of the applications of public health, this broad conceptualization of health really gives us a powerful tool and a powerful lens through which we can really understand many of the root causes of health outcomes. So as we're trying to figure out why we may see disparities in heart disease mortality and morbidity in certain areas, certainly it may have something to do with the levels of physical activity and the types of nutrition that individuals have access to and that individuals engage in those neighborhoods. But it's also likely to be a function of the economic factors in that neighborhood. Are there good jobs? How far do people have to travel? Is there access to transportation? When we think about environmental health, are there pollutants in the environment that are being emitted through industries or other other complexes in the environment that are having a detrimental impact on the health of populations. And this is just a small snapshot of it. Certainly when we think about the educational structure within a community, that has a tremendous impact on the health and well-being of individuals in that community. Areas where we tend to see a clustering of poor health outcomes and poor economic outcomes, we also find that there are significant deficiencies within the schools that exist in those communities. So whether those schools are underfunded, whether there is a school climate that is not conducive to learning, or there aren't adequate resources to help the children and the families who go to those schools. So the World Health Organization has what we really think of as probably one of the most established definitions of health, and it's really the definition of health that is integrated across a number of different areas of public health activity. So the World Health Organization defines health as a state of complete physical, mental, and social well-being. So it's not really just about the absence of disease or infirmity. What the World Health Organization does, and what they did several decades ago, was really bring to the forefront the importance of well-being as one of our primary lenses through which we should be viewing health. So this means that we're not taking a reactive approach to health. We're not really focusing on health only when people become sick. We're not focusing on health only when we start to see negative trends in terms of health outcomes, but really being proactive, looking at what we need to do to promote the highest quality physical and mental health for individuals, and social health and well-being as well. And this brings into focus an area of health that's becoming a much greater focus in public health right now, which is this whole issue of social isolation. And as we look at demographic trends within our population, what are some of the key things that we should be thinking about? So social isolation among elderly residents in communities is becoming a really important public health issue, and one that we have the opportunity to address now in order to promote and really protect the health of those individuals as they move forward. So we talked about some of the themes in public health, but what I'd like to do is shift a little bit to some of the big trends that we're seeing in public health. I just mentioned the changing demographics. One of the biggest shifts that we're going to see over the next several years in public health and in our society as a whole is the shift in demographics, the significant growth within the population of individuals who are 60 and over. And that really has a significant public health impact for us, and a real public health opportunity in terms of focusing on some of those key issues that are important for elderly populations. We're also seeing a growth in populations who are living with disabilities. We have much better, we have better healthcare now. We have improved opportunities to treat different types of illness. So we are also seeing an increased prevalence of chronic diseases, both in terms of the fact that people are being able to live with diseases much longer now than they were, certain types of diseases, than they were many years ago. But also there's a negative side to this. As we see the increased prevalence of chronic diseases, it's also tied to significant increases in levels of obesity and hypertension and diabetes. So that also offers us an upstream opportunity to really think about how we can prevent this. One of the biggest trends in public health right now is the availability of new technologies. Digital health, connected health. Many of you may have watches on your wrist right now that are monitoring how many steps you take and that are monitoring your heartbeat. These technologies offer us a real powerful opportunity to innovate in the areas of prevention and intervention. And it's only going to grow. The areas of connected health, digital health, health informatics are probably one of the areas of most significant growth in the field of public health right now. The other big trend in public health is this focus on health in all places and all policies. So as we saw in the earlier slide, it's more than just thinking about physical and mental health. It's really it's about understanding and applying this concept that health has to do with transportation and housing, access to healthy and affordable nutrition, access to high quality education. Health, really, almost every policy can have some sort of an impact on health. And we have some great tools that enable us to really understand the health implications of different policies. One of those tools is called a health impact assessment. But this idea that health occurs and is impacted by all policies, that health can occur in all places, gives us an opportunity as public health professionals to not just collaborate with a broad range of partners, but for any of you who might be thinking about a career in public health or who might be thinking about getting a public health degree, it also offers a real opportunity to apply that the knowledge and experience that you'll get from a public health degree to all kinds of different occupations. The other big trend in public health is the focus on social justice and health equity. Unfortunately, many of the disparities that we see today are the same disparities that we've seen for the last 30 or 40 years, if not longer. What we're seeing today is not just a greater focus on social justice and health equity, but important initiatives to address the root causes of health disparities, to make sure that we promote health equity through new policies and new programs, and that we apply a social justice lens to all aspects of our public health work. So when we think about social justice, this is a really important paradigm in the field of public health. When we think about social justice, there are there's three domains of equality and equity that we often think about. And these aren't the only three domains, but these are three important domains of equality and equity. And these include equality of rights, equality of opportunities, and equity in living conditions. So as we break each of these down, we can see how these apply to a really broad cross-section of different policies and programs. It's not just about access to healthcare. When we think about equality of opportunities, it's making sure that everyone has the same opportunity for getting a high quality education and for being able to apply that education to get the types of jobs that they want, that people have the same opportunities for healthy and affordable housing, that people have the same opportunities for employment. Similarly, when we think about equity in living conditions, really thinking about not just the most proximal living conditions, but when we think about the broader environment and really asking ourselves, why is it that certain communities have a significantly higher concentration of sites that emit hazardous pollutants in the area? So areas like Roxbury and Dorchester rank in the top 10 in the state in terms of sites that emit hazardous pollutants, whereas other communities in Massachusetts are not even on that list, and really asking ourselves, why is that the case? So when we think about some of those areas of inequality, it's certainly about the distribution of income, opportunities for work, and for being properly compensated for that work. But it's also about access to knowledge. As many of us know, employment and income are often a function of education. When we think about civic and political participation, this ties into this larger concept of social capital, and really thinking about the degree to which communities are not just empowered to advocate for what is most important to them, but they have the political capital to be able to advocate effectively, that they have opportunities to bring the community together, to have that discussion within the communities to figure out what is most important. And importantly, the distribution of health services. Here in Boston, we have some of the we have one of the highest concentrations of academic medical centers and community health centers in the country. Yet we see significant disparities in health outcomes in communities where you can see from those communities, you can actually see some of these healthcare institutions. So really asking ourselves, what does that mean in terms of both the distribution of health services and the access that individuals have to make the most of the services that are available to them? So another major theme in public health, and this is more than a theme in public health, this is really an organizing framework for how we approach much of our work in the field of public health, is the concept of social determinants of health. Some of you may have heard this term, social determinants of health. All of you are familiar in one way or another with the characteristics of this term, with the components of this term. Because social determinants of health are all about where we live, work, eat, play, and pray, and how all of those different environments help build a foundation for either good health or how they contribute to poor health. As we saw earlier, where we live, both through the environmental factors, through other factors, can have a significant influence on health. Where students have the opportunity to learn can have a significant influence on health, not just in the near term, but over the course of their lives. So the social determinants of health are really, they represent a frame of thinking and an organizing framework that help us not just think about the root causes of health, but as we try to tackle some of these deeply entrenched public health issues, this framework helps us bring into focus other sectors that should be a part of the conversation and that should be a part of our work. So the social determinants of health have really offered us a great opportunity to collaborate with different sectors. And what we used to call non-traditional partners, and what I now like to call our typical partners. So our partners in the transportation sector, in the housing sector, in the economic development sector, all of these sectors, and of course the education sector, all of these sectors have a significant intersection with the field of public health, and they're increasingly becoming typical partners in our work. So we're going to shift gears a little bit and really focus on urban health. The term urban health encompasses a lot of different factors and influences. And as we just think about the health within an urban environment relative to either a suburban environment or a rural environment, there are a couple of key things, key factors that really come to mind and that should come into focus. So one of the defining characteristics of urban health is the fact that when we think about urban health, we're thinking about the fact that there is a relatively large population that is experiencing similar living conditions. So if we think about individuals who are living in neighborhoods like Roxbury or Mattapan, or individuals who may be living in a certain neighborhood in New York or Detroit or Chicago, that you could have thousands of individuals who are all exposed to the same set of factors because they're living in similar conditions, whether it's in a similar housing complex or a similar neighborhood that is influenced by the same factors, whether it's same educational factors or environmental factors. When we think of urban health, we think of an entire population. We're thinking about the health of a much larger population, and our approaches to health and the way that we conceptualize opportunities to both address prevention, address intervention within this population is shaped by this idea that we're now thinking about it on a larger scale. The other important common factor for urban health is that the social determinants of health are intricately woven through all aspects of how we approach health in urban environments. So when we think about these social determinants, it's really thinking about how do we leverage opportunities within the educational system? How do we leverage opportunities in terms of economic development or within the housing sector to improve health outcomes for an entire community? So let's break down the concept of social determinants a little bit, so we can see we can really see what what does this comprise? So when we think about the social determinants of health, we have different factors. So for all of us, we have our own biological factors that influence our health. We also have lifestyle factors. How often do we exercise? What do we eat? Do you drink? Do you smoke? All of those lifestyle factors can have an impact on health. But beyond that, we also have our social and community networks that influence our health. So this is both the social support that we have when we're trying to engage in a health promoting behavior, or also the social factors and the social cues that may support negative health behaviors. The social and community networks can also have a big impact on larger scale health outcomes. So when we think about issues like violence and trauma in communities, social and community networks can play a big role in mitigating the impact of those larger public health issues. But then beyond that, it's also the living and working conditions within a community. So the levels of unemployment in a community, the quality of the water and sanitation services in the community, the access, not just the presence of healthcare services, but the access that individuals have to healthcare services. And this is not just having a community health center available that anyone can go to, but really making sure that everyone in that community can physically get there. And that becomes an issue of transportation. It becomes an issue of health literacy. So really thinking about healthcare services more broadly. Certainly, as we talked about, housing and education are important determinants within this larger idea of the social determinants of health. But it's also the quality of food that's available in the neighborhood and the work environment that people experience. There's a lot of research that has shown that certain industries have significantly higher rates of health risk behaviors and poor health outcomes relative to other industries. There are certain work sites that have a greater incidence of workplace injuries. So really thinking about the working environment is important when we think about the determinants of health. So now we're going to talk briefly about a couple of practical applications of public health, just to give you a sense of how do we put all of this work, all of these concepts into practice. So the first thing that we're going to talk about is health assessment. So health assessment is something that is becoming a much larger area within the field of public health. All nonprofit hospitals have to conduct community health assessments as a result of a mandate within the Affordable Care Act. But community health assessments in general are becoming a much more important tool in not just engaging communities to understand what is important to them and what are the most important health outcomes for them, but also empowering them to identify solutions to the health problems that they see. So when we think about health and when we think about health assessments, it's important to have a broad conceptualization of health, because how we conceptualize health is really going to direct how we're going to assess health. So when we think about a narrow conceptualization of health, if we were to go in and say, well, we're just going to look at what's related to heart disease within a community, that will give us a very different assessment relative to a broad conceptualization where we're really looking at what are the different economic factors and environmental factors that are influencing a broad range of health outcomes. So as you think about this narrow versus broad conceptualization of health, what does this mean to you when you think about community health? So this is an opportunity for you to chime in the chat box. So the community health assessment, or what we sometimes also call the community health needs assessment, is a systematic process to identify needs and resources in a community. And this really involves a comprehensive collection of both qualitative data, so focus groups, key informant interviews, other types of qualitative data. We've had community health needs assessments where we've conducted large community forums and town hall meetings, and quantitative data. So the data that we typically see that's put out by state departments of public health or local public health agencies, the quantitative data that we have available through our health system partners, or other quantitative data that's available at the community level. So it involves not just collecting that data, but in analyzing it to really identify some of the key themes that emerge that help us better understand what are the core health needs within a community. And again, it's not just about the physical health needs and mental health needs of a community, but also what are some of the areas of environmental health and economic health that are influencing the broader health of the community. So community health assessment is one of the core public health functions. And this also underscores why, not just why it's becoming a larger area within the field of public health, but we're also seeing the importance and the relevance of community health assessment in other areas of public health. Community health assessments play a big role when it comes to developing policies, helping us really identify the policies that need to be developed or the policies where we need to have greater advocacy so that we can have a larger impact on and a more beneficial impact on the health of populations. Health assessment is also tied to the assurance function within public health. Both when we think about assurance, it's both about the provision of care, making sure that we have systems in place to provide the highest quality of healthcare to individuals and communities, making sure that the workforce, both within the field of public health and healthcare and beyond that, is adequately prepared to address the health needs of the community. Let's just talk a little bit about, I've mentioned the concept of disparities a couple times now and this idea of health equity, but what I wanted to do is actually show some data that really brings this to life. And so when we look at these charts on these four graphs here, there are a couple things that should jump out here. So in this first graph, population by race and ethnicity, so this is data from Boston from 2009. We see that in Boston, whites comprise about just over 40% of the population in Boston. However, when we look at the population living below the poverty level from 2005 to 2009, we see that among Asians, Blacks, and Latinos in Boston, that a higher percentage live below the poverty level relative to whites. The educational attainment graph should be somewhat striking to all of us because education is one of our most powerful tools to really improve health over the long term. We see significant disparities in Boston, not just in 2009, this data holds today as well. When we look at whites versus Asian populations, Black populations, and Latino populations in Boston. And for those who have less than a high school education. For those who have a bachelor's or higher, we see a significantly greater percentage of Asians, of the Asian population and white population that have a bachelor's or higher relative to Black and Latino populations. So this should give us a sense of what does this mean, or help make us ask, what does this mean when we think about health outcomes? So I'm going to focus on one health outcome in particular, because this is really seen as the beacon of well-being in a community. So when we think about the infant mortality rate is really seen as the most important health indicator of a given population. So this could be a population defined by geographic area, it could be a population defined by race or ethnicity, or a population defined by other factors. But typically, where we see a higher infant mortality rate, we are likely to see higher rates of poor outcomes across other areas as well. So what we see here in Boston, and this doesn't apply just to Boston, this is something that we have seen nationally, and we've also seen in almost every single urban center across the country, is that from 1996 to 2008, infants born to Black women had significantly higher infant mortality rates compared to infants born to women of other races or ethnicities. So there's been a lot of research to better understand why this is the case. And one of the things that's really jumped out is the fact that the role of racism in particular has a powerful influence on infant mortality rates because of the impact of exposure to racism on the body's stress responsive axis and the long-term impact of that exposure on both pregnancies and other health outcomes. So when we conduct a community health assessment in a community, there are typically a series of steps that we're going to go through. And all of these steps involve engaging the community in a genuine capacity. So not only do we want to get buy-in from the community, but we also want to make sure that those individuals are a key part of the planning process. And so we want to make sure that they're involved in the working group. We want to make sure that we have clear parameters, because with a community health assessment, we can often really get very broad, and it's something that could wind up taking many, many months if you don't have clear parameters. Certainly, we want to identify the audience, so not just the audience for the data collection, but what is the audience for the assessment itself? Who is this going to be tailored towards? Are we writing this assessment or conducting this assessment for the community members, for health system partners, for political leadership, or all of the above? We want to make sure that we engage other stakeholders. And importantly, we want to make sure that we have clear goals and objectives that will guide the assessment. Related to this are the metrics that we're going to identify that will help us determine the outcomes of this assessment. And then the questions that we're going to develop that will help frame the qualitative data collection. Of course, we need to identify the other data sources, and in the end, the fun part, which is analyzing all of that data, figuring out what it tells us, and then reporting back to the community. The piece about reporting back is really where the rubber meets the road when it comes to community health assessment, because that's where we begin to have the discussions with the community in terms of how we're going to partner to develop and implement those long-term solutions to health. So we're going to do a quick overview on a second application of some of these concepts, and that's around health education and how do we plan health education and health promotion programs. So we've all been exposed to health education in some way, shape, or form, whether or not we're in the field of public health. If you've seen a health promotion message as you've gone through school, many of us have been have seen different health education messages. So there are a couple of different definitions, but one of the key things about health education is this idea of a combination of learning experiences to really help individuals and communities improve their health. So health education is all about increasing knowledge and really leveraging that improved knowledge to influence behaviors and attitudes. Health education also involves figuring out how we're going to get the information to people. What are the best ways to frame messages? So we had talked about health communication being a key part of public health, and that's very much tied to the area of health education. So health education and health promotion, while they're related, are also two distinct concepts. So while health education was all about getting information to people, helping to increase their knowledge and awareness in order to influence their behavior, health promotion is really about figuring out what we can do to enable people to have better control over the factors that are related to their health, over the factors that will help them improve their health. So it's not just about individual behavior. Health promotion is really about that larger, that broader range of social and environmental contexts and interventions that are available to us to improve health. So for example, when we think about tobacco use and our efforts to curtail smoking and tobacco use, it's not just about all the different health education campaigns that we see out there, but it's also about all the policies that have been put in place to have smoke-free workplaces, to increase the age at which individuals can buy cigarettes, and importantly, to make cigarettes themselves much more expensive through higher taxes. So the health promotion model really ties together these two concepts of health education and health promotion. So as we see with this model, while health education is really at the epicenter of all of this, there are a number of other factors that come into play when we think about true health promotion, when we think about what we need to help people truly have control over the opportunities to improve their own health. And this includes economic factors, social factors, organizational factors, the policies that are put in place, regulations that are put in place, and also the political environment as we're seeing right now. That is not a political statement, but just a broader observation. So when we're developing a program plan, or when we're planning a health education or health program plan, health promotion program, there are a couple of common steps that we typically take. And as you'll see, there's some similarity here between developing a health promotion or a health education program and community health assessment. So both are all about understanding and engaging the community. Public health is really about making sure that we're not just engaging the community and learning from them, but really making the community a true partner in the work that we do, especially when we're trying to tackle issues that are deeply relevant to certain communities. Another key step in program planning is assessing the needs, really understanding what is most needed by the community. So while we may go into a community thinking that our focus should be on addressing infant mortality, the community may tell us that, hey, wait a minute, it's not about infant mortality. We need you to focus on education because that's what we think is most related to the poor health outcomes that we see. Or they may say, don't focus on infant mortality, but rather focus on making sure that we are helping young parents and helping address the needs of young parents. As we saw earlier with health assessment, setting goals and objectives is a key step in program planning, and perhaps one of the critical steps of program planning. Goals and objectives really help guide the work, and they help develop the framework for evaluation that will then, in the long term, help us understand the impact of this program. We also want to develop interventions that take into account contextual factors. It's not unusual to see programs that are very well intentioned but don't account for some key factors in the day-to-day lives of individuals that can have a profound influence on the effectiveness of that program. And then, of course, one of the important steps in program planning is to not just plan the program but actually implement the program and evaluate the program. So when we think about program planning, we really want to take a systems approach to this. And this idea that the planning process is something that should be interactive. So one aspect of the process should influence and be influenced by other aspects. That each of these steps are connected. And importantly, that there's communication across all of the different steps of the program, but also between all of the stakeholders in the program or in the program planning process. The issue of visibility is also important, and this ties to communication. Visibility means that there's some degree of transparency in the program planning process. And this can have a big impact on not just the buy-in that stakeholders will have and the level of investment that they have, but this can have a big impact on the sustainability of the program, oftentimes once that initial funding ends. So why is a systems approach to planning important? Well, one of the key things is that this helps us develop some sort of logical framework when we're developing these programs. As we often see with developing health education or health promotion programs, they can be a pretty significant undertaking with a lot of different moving parts. So we really want to take the most logical, we want to apply the most logical framework possible. We also want to make sure that we focus on the outcomes, that we identify clear performance measures, and that we have clear goals and objectives that are going to guide this work. The systems approach also enables us to maximize the skill sets that different stakeholders and different partners are going to bring to the table. And importantly, we want this to be an iterative process. We want to continue to improve the programs that we're developing, and a systems approach will help us to do that. So I'm going to just spend a minute to talk about the needs assessment because this is another important component, not just of the program planning process, but as we saw earlier, this idea of needs assessment in public health is really important because the needs assessment process helps us not just identify what is important for the priority population or the community that we're working with, The needs assessment also helps provide justification for the program. And this is important when it comes time to asking for money to support this program or to support a given program. The other thing about the needs assessment is because the needs assessment is built on both qualitative and quantitative data, it inherently provides a data-informed approach to what you're doing, which increases the likelihood that your approach will be successful. The needs assessment also gives you that opportunity to engage key stakeholders, to really make them a part of the planning process, of the implementation process, but it also means that you're going to have a greater opportunity for sustainability because you're going to have those stakeholders will have greater ownership over the process. And then also you're going to have the opportunity to identify not just the key factors that are going to influence an outcome, but importantly, you're going to have the opportunity to identify those key assets within the community that you can build upon to develop and implement a program. So this includes community health centers, schools, parks, community recreation centers, a number of different health promoting assets that should be a part of both the conversation and the planning process. So that was a serious crash course in public health. So I want to make sure we've got about 15 minutes for questions. So leave some time if you have any questions for me.
Hi, Neil. We do have a few questions that came in earlier throughout the session. So if you just want to scroll up on the chat, and then we can wait for a few others to come through as well.
Sure. So those, so I'm just going through this. So Arthur raised the point of preventative care versus treatment of disease when it comes to healthcare, and that's a really important focus for us right now. When we think about the opportunities for prevention, we have some really powerful opportunities, both in terms of the technology that we have available to us, but also the policies that we have in place right now to really focus on prevention. But also there's a big shift right now in healthcare and public health in general to have a greater focus on prevention, because it's also seen as a real opportunity, both in the near term and the long term, to lower healthcare costs overall. The other question was, what are some of the initiatives and ways in which health inequities are being addressed in the U.S.? So I'll give one important, one important way in which we're addressing health disparities. Community health workers are really on the front lines of public health, and community health workers have emerged as a really important group of public health professionals when it comes to tackling some of the really deeply entrenched disparities that we've seen in areas such as diabetes, chronic disease management, HIV reduction. So the larger solution there is the fact that we've found that we need to bring healthcare and public health to communities, and we need to really make sure that we take into account the cultural factors, the systemic factors that influence health. And that is one way that it's really helping us tackle some of these more deeply entrenched health disparities. And so, Arthur, to your point, there's definitely this idea of health coaches that's a great point that you raise. And it's something that's really getting a lot of attention right now in areas where we're seeing relatively small percentages of the population account for a relatively large percentage of healthcare utilization. And health coaches are, I think that's a model that's really going to get a lot more emphasis as we move forward. So thank you for raising that. Other questions? So question came up, where's the field of public health headed? That's a great question. So there are a number of different areas where public health is really taking advantage of both the technology that we have available to us, but also where the field is starting to integrate new partners and new sectors. So I think one of the biggest opportunities in terms of where the field of public health is going is around connected health, digital health, and health informatics. So there's a much greater focus on leveraging large scale data sets to better understand not just the health outcomes that we're seeing, but to understand some of the root causes of those health outcomes. And also integrating different streams of data so we have a much more comprehensive picture of what's going on. When we think about connected health and digital health, that's a real opportunity to help increase access to health care. So some of you may have heard of the concept of telemedicine, and telemedicine is being used, more widely utilized now to connect individuals to healthcare resources when they may either be experiencing transportation challenges, or particularly in individuals who are living in rural areas or areas where there's a significant distance from where the individual lives and their healthcare provider. Telemedicine is a real opportunity to help bridge that gap. I think the other big opportunity in the field of public health is really as we think about the changing demographics and the increase in the elderly population. A focus on healthy aging, a focus on chronic disease management is another big opportunity in the field of public health. Other questions?
If there aren't any more questions, we can go ahead and wrap up this session. This month's urban health content, including a recording of this session, will be archived on our website. Thanks again for everyone to joining. Check out the Office of Alumni Relations website for upcoming events and programs, and have a great day.